It's probably fair to say that no one wants to have to call in the Canadian military to backstop long-term care in Ontario ever again. That's just the most glaring instance of trouble revealed during the pandemic in caring for older and frail Ontarians. It's not the only trouble, not by a long shot. What have the parties learned, and do they have solutions on offer in election 2022? Let's find out. We'll ask. In Aurora, Ontario, Charlene Stewart. She's president of the SEIU Healthcare Union. And in the provincial capital, in the St. Lawrence neighbourhood, Donna Duncan. She's the CEO of the Ontario Long-Term Care Association. And from his office at Mount Sinai Hospital, there's Dr. Samir Sinha, Director of Geriatrics at Sinai Health and the University Health Network. And as I welcome the three of you back to our program, I occasionally have to do this in the interest of full disclosure thing. My wife's a health policy consultant, and about a dozen years ago, she did a policy paper for the Long-Term Care Association. Donna, that was a decade or about a decade before you got there. So, but, you know, for what it's worth, we put that on the record in the interest of full disclosure. All right, let's get into this. Samir, the biggest problem in long-term care that it had to deal with during the course of the pandemic was fill in the blank.
Staffing 100%. You know, again, we were already grossly understaffing our long-term care homes prior to the pandemic. And that only led us into more trouble and a lot more challenges in trying to get out of it as well.
Just put a little more meat on that bone. When you say staffing, you mean what exactly?
Well, I mean the people who provide the care in our homes. Right now, our government was providing about 2.7 hours a day of funding, and its own staffing commission that it set out actually said that we need to be providing at least 4 hours a day of care. So already we were underfunding our homes to provide adequate staffing. Our staff aren't paid well to begin with in our long-term care homes. They're paid far worse than working in a publicly funded hospital versus a publicly funded long-term care home. And we knew that the majority of homes prior to the pandemic were having trouble recruiting and retaining staff. So that really set us up for failure right off the bat. And it really made it a struggle to continue to providing high quality care throughout the pandemic. And frankly, it's going to be a struggle to reach the levels that we need to moving out of this pandemic as well.
All right, we're going to spend the next 20 or so minutes looking at the platforms of the four major political parties in Ontario during this election campaign, and then we'll get the three of you to comment on the strengths and weaknesses thereof. Let's start with the former governing party, the Progressive Conservatives. Here's what they have offer when it comes to long-term care. They say they will provide 30,000 more nursing home beds by the year 2028. They plan to spend $5 billion to hire more than 27,000 long-term care staff. They would ensure long-term care residents get an average of 4 hours of direct hands-on care daily. And they offer $8.3 million over 3 years to add 40 behavioral specialized unit beds at long-term care homes in Ajax and in Mississauga. Okay, Donna Duncan, start us off. How does all that sound to you?
Well, it's a start, but it's also a start building on significant movement that has happened over the last 2.5 years. And it's tragic that it took COVID-19 and thousands of deaths in order for a government to move forward after decades of lack of investment. We know we need to rebuild our homes. We know that we need to modernize homes. We need more spaces. We're not going to build out homes for everybody, but we need more and better. And we need to make sure that every community in our province has access to long-term care supports. We need to recognize that who our residents are and build out more structured relationships and better staffing models and staff teams to be able to support our residents. As we look at those 27,000 staff, we estimate we'll probably need more than 60,000 once we add the need for workers with those new spaces that have been committed. Government hasn't put its mind to how and where we're going to find those people yet, knowing that home care needs more staff, hospitals need more staff. There's more work to do by anyone who forms government to really understand who's going to be retiring over the next year and what the real scope of the HHR problem is. But work has been done. We have more partnerships with hospitals, emergency services, and others than we ever had before. We have more IPAC. We have relationships and more formalized in legislation today now now, relationships with our family caregivers, and that's an important thing. We need to keep moving forward on important initiatives that the government has done, but there's clearly a lot more to do.
All right, Charlene Stewart, if in fact a lack of workers in the system is problem number one, do you think the Tory platform goes far enough to address that?
No, and first of all, Stephen, let me tell you, I am very excited and thrilled to see senior care a top priority in all of these platforms. It's long overdue, and I'm excited to see that they're addressing it. And I'm happy that the public is demanding it, quite frankly. The choice in this election is either continuing the status of a failed system, status quo, which quite frankly, we've seen it. It definitely, the status quo, what we've seen, has exploited female-dominated workforce. We know that it is. It also, the status quo has demonstrated terrible outcomes for seniors versus bold reforms that focus on care instead of the profits of the nursing home corporations. And I'm afraid that's what I'm seeing. It's witnessing in one of the platforms that it's making a bad system bigger, not fixing a bad system and making it better. It means having elder care be about care and not about the needs of for-profit business to deliver for shareholders. It means not having nursing home executives mandate from corner offices the rationing of adult diapers for our elderly moms and dads, or limiting how many baths are given each week just so they can squeeze out more profits. And again, what's exciting about these two platforms is that there is recommendations of complete transformation or reform, thinking the way people at home are thinking. We've heard them. We need to revolutionize the long-term care system. I'm worried that even after what we've seen over the past 2 years, Doug Ford's plan, there's a lot of promises in it, but unfortunately, I see that just doubling down on a system that's not working, the status quo. The other two parties are definitely
well. Hold off on them. We're going to get to them. We're going to lay out in chapter and verse what they've got on offer. But okay, I take your point on the Conservative platform. Samir Sinha, why don't you come in here and tell me what do you like about this platform? What do you think doesn't go far enough?
I think what I like about, this platform and the other platforms is that there's more investment being focused around, care for older adults and particularly people who might need long-term care supports and services. The problem that I agree with Charlene is that this is just more of the same. Fundamentally, this platform doesn't talk about a fundamental change. It just says we're going to double the size. We're going to build 30,000 more beds. We're going to build them to pre-pandemic design standards with 2 or more people to a room, even though the new national standards for long-term care say it should be 1 person per room. Smaller home models, no, we're building more of the same and not necessarily fixing basic issues like air conditioning or making sure that we actually have things like wage parity so that people working in these systems actually have access to good benefits and actually a reasonable paying job. And I'm not saying make more money than people who work in hospitals, but make the same in a publicly funded system. But also thinking about this is a platform that frankly is all about building more beds, building more of the same. It makes, as Donna said, staffing projections, we're going to hire 27,000 more workers. Well, our own government's budget office said, actually, for your plan, you're going to need to hire 35,000 new workers just for what you're actually planning right now. So you haven't thought about those extra people. And right now you're talking about 4 hours a day, but that's an average across the system. It still means that we could actually have homes that are still operating with less than the staffing that they need and not being penalized. And it's great that we're talking about having tougher legislation, but we haven't fined a single home. We haven't taken away a license. And we put a liability shield saying, hey, for all the negligence that occurred, not a problem. We're going to make sure that you're okay. So I'm a bit concerned that this platform is one that just speaks about more of the same. And I think all parties are talking about building more beds and just doing more of the same thing, as opposed to necessarily saying, how do we think about long-term care more broadly? And how do we really look at true system transformation?
All right, that's the Conservative platform. Let's look at the other parties' platforms as well and see if there is anything closer to what you would like in any of those platforms. The NDP were the official opposition in the last legislature, so they're coming second. And here's what they have on offer. Immediately begin building a public, nonprofit system to provide home care and long-term care. Immediately build 50,000 new and modernized beds into the long-term care system. Create new and stronger protections, such as comprehensive inspections and a seniors advocate. Build more small, modern, family-like homes and provide a caregiver's benefit program for informal caregivers. All right, let's start with Charlene this time. What do you like about what you see there? Where do you think it falls short?
Well, like I said, they are definitely showing a more bolder, progressive vision of what they see a long-term care, senior care being. I am pleased to see that they are focusing on home care as a solution, because let's be honest, in Ontario today, long-term care has become a place that nobody wants to be. And we should deliver care where people want to be. They want to be in their home. And that is exciting to see them focus on home care. Yes, the universal wages across the system is also what's going to help us with the retention and recruitment problems. You know, right now there's a shortage of long-term care, especially PSWs and RPNs. So to have a universal wage across the system so that the competitive model is not there, because these workers are following the money. Again, it's more modernized in the 21st century, 2022. I think that's a start. We have to start looking at giving people who we care for the care that they want in this time, and caring for those who care for them, because they're so very much connected to each other. So that's what I like about that platform.
All right, Samir, what do you say?
Yeah, I think this is a more progressive platform that starts thinking more about system change that we actually need. Because again, when we talk about building more beds, right? We had our premier there a few weeks ago standing in front of a 320 bed new building in a parking lot of a hospital, right? And I remember seeing them pan at the rooms and what they look like. I'm sorry, but that's not a place that I think feels home-like, looks home-like. And in developing the new national long-term care standards, this wouldn't actually meet what Canadians and what the experts say that we actually need. So I like the idea that they're saying that if we're building new beds, let's actually build more small home-like settings where the evidence actually says you get better outcomes of care for not only the residents, but also better conditions of work for the workers. But they're also thinking about, again, how do we think about our workers, and how do we actually think about more ways of supporting people to stay in their own homes? Because when you continue to grossly underfund our home and community care system, you then artificially inflate the wait list. Because I have so many patients who don't need to go into long-term care. We know CIHI, our Canadian Institutes of Health Information, says that in Ontario, perhaps a third of the residents in our long-term care homes could have been supported in the community if there was adequate home and community care. So again, how do we think about greater system transformation that's delivered in a more equitable way?
All right. Donna, do I assume that the first plank of the NDP platform, namely to get rid of all private long-term care homes, that's kind of a non-starter for you?
Well, we estimate that to the original Conservative platform, if we were looking at 45,000 spaces, if the government were to build it, that would be between $13 and $15 billion. We need to rebuild our workforce, and it's going to take all of us working together to rebuild the sector. And we're going to need the private sector in building out our homes. People don't choose to be in long-term care. And Charlene, I think you and I both know that we need to instill pride of work and recognize and value the heroes who are long-term care staff and validate the work they do. It's really important work. It's very challenging in working with families and the care needs of the people who are living in our homes. We know that those care needs are only escalating. And Samir, the most recent CIHI data from John Hurdy's in a recent news article said 9% of the people shouldn't be in long-term care. So we do need to build out home care. We need to make sure there's a workforce for home care. We need to make sure there's a workforce for long-term care. We need to deal with the wage disparities. We need to make this an attractive system, and we need to support our residents and our families, recognizing that for so many and too many people, staying at home is not going to be an option And yes, we do need more home-like environments for emotion-focused care. But the reality is, and we're seeing it, and we're waiting for the data to catch up, the people who are coming into our long-term care homes are end-stage dementia, people with very, very heavy care needs. And Charlene, you know this from your team members, people who need heavy mechanical equipment, more specialized services and supports. And we've got to understand that we've got to recognize the geography of Ontario. Home care is a real challenge in rural and remote communities. We know that our largest homes actually are hospitals, to your point, Samir, and municipal homes. In our small communities, we have small homes, but we have severe staffing shortages, and we've got to step back, differentiate the system, have more specialized, customized long-term care homes. We know baby boomers aren't going to accept what we have today, not a cookie cutter.
Okay, Donna,
So
let me
it
jump
has
in
to be
there if I
about
can.
change.
Thank you. Just I want to make sure we save time for everybody's platforms here. So let's move on to the Liberals, who, like the NDP, want to see an end to for-profit care, but they are going to do it in a different way, and they would take more time to do it. They would end for-profit long-term care by the year 2028. How? By no longer renewing licenses and financing the transfer of existing for-profit homes to the not-for-profit and municipal sector. They would also, the Liberals say, build 30,000 new long-term care beds and modernize 28,000 spaces. They would ensure long-term care residents get at least 4 hours of direct care daily, as recommended in that famous report. And they would raise the minimum wage for PSWs to $25 an hour. And I guess just before I get everybody in here, Sheldon, let's bring up this next graphic as well, because this will help us understand the difference between the sort of public and private aspects of this system. Here's Ontario long-term care by the numbers. There are 360 for-profit homes. There are 162 not-for-profit homes, and there are 101 municipally run homes. So as we think about, as a couple of the parties want to, privatizing the current system, that does give you an indication of the challenge ahead for that. Okay, that's the Liberals' plan. Samir Sinha, start us off. What do you like? What aren't you sure about?
Yeah, so I mean, the key is right now that this current government has already actually given away most of the licenses. So they've already given out about $6 billion, to provide support for building 30,000 new beds and then focus on redeveloping 28,000. So a lot of these licenses have already been renewed, and so transferring licenses and moving a largely for-profit system and 30,000 new licenses that are largely going to be going to for-profit holders, it'll make it very expensive to transition a for-profit system where it's not only about ending licenses, but if you want to keep that property in the land, the government, while it paid for all this and it's given it away to these for-profit operators, it would ironically have to buy all that back. So as Donna said, that's going to be billions of dollars. I think what I like more about this platform is that they, again, are focusing on the fewest number of beds. The NDP have said, we want to build 50,000 new beds, right? No. 30,000. I don't even think we need to build that many, to be perfectly honest, because if we adequately funded our home care system better, we could actually support more people to live in their own homes. So what I do like is that in this platform, accompanying these statements are two other things. One is they've made the greatest pledge to build out our home care system more. $2 billion versus $1 billion for the other parties, to say, let's give 400,000 more people home care, because 1/3 of Ontarians who have home care have unmet home care needs, which drives them into long-term care. And the other thing is, while the current government is talking about a $3 PSW wage increase, yay, the NDP have talked about a little bit more of a wage increase. This is the party that said, let's set a minimum standard PSW wage rate of $25 an hour, which would actually provide a much better living wage than we currently have, that the other two parties are offering. So I think there are more elements here that I find useful and helpful to get us to more of where we need to be. But again, it's a lot of tinkering, not as transformational as I think it could be.
Donna, what do you see here?
Well, again, $13 to $15 billion to take over beds, and what we're reading with the Liberal platform is they're actually going to close the beds, and so that's 43,000 spaces for long-term care when we have 40,000 people on a wait list today, and we are about to face the biggest wave of octogenarians in Ontario in our history. We don't have the frontline staff. We would much rather see those that 13 to 15 billion dollars invested in our front line, and whether that's in home care, long-term care, home community care, mental health care. It's going to take all of us working together and isolating and trying to dismantle long-term care at such a critical moment when we know it's going to take hospitals 3 to 5 years to recover from the pandemic. Closing homes over the next 3 to 5 years is so disruptive to our workforce, to our residents, and to our families. This is a time to build. We're committed to building and working with whoever, and whoever forms government is going to face this stark reality, notwithstanding their commitments in a campaign.
Charlene, your view of the Liberal platform.
Well, I mean, phasing out of the for-profit system is going to take time and it's going to take money. There's no doubt about that. Nobody's denying that. But it's the time to do it. You know, Donna talks about the money. Well, maybe the billions of dollars that are being put into a new highway could have been put into the transformation of long-term care, a highway that not very many people are going to use. And we've got, you know, numbers that are like just exploding for future use of senior care, not just institutional care. So, you know, let's be honest about the kind of corporations that dominate long-term care. They are not in the business of care. They are in the business of property and making money. And that's why you see the results and all of those numbers that were up there in those for-profits. We've got the data on it. We all lived through it in the last 2 years. The flags were up before the pandemic. But those corporations have fewer staff and fewer full-time staff. They have lesser paid staff. They have greater staff turnover. They have more frequent admissions to hospitals for things like bad sores and other infections. Look at the lawsuits from families for systemic neglect that happened over the last 2 years and prior to that. So instead of investing profits to improve care, they deliver those profits to the shareholders. And we know that. We saw that over the last 2 years, that the for-profits made sure that their shareholders got their money off the top, even when others were suffering during this pandemic. So every single large nursing home is looking at the opportunity to make more money over the next decade. And like the doctor said, why, when we know that the for-profit performed much worse, did we give companies like Sienna, who the armed forces said were deplorable, giving them licenses for 30, 35 years? Like, that does not indicate that this government today is really serious about charging those companies for the bad performers, that they are definitely have no intention of even starting to balance out the for-profit versus the not-for-profit. They're just doing a status quo of a system that is broken. And this election is our time to say, no, we want different, we saw different, and we're going to demand different.
Okay, let me, Don, I know what your position on much of what Charlene just said, so I want to go to Samir to get a response to that. The quote was, the private operators are not in the business of care. Samir, do you think that's a fair statement?
No, they're in the business of care, right? Everybody here is in the business of care. It's just, what is your ultimate focus and what is it about? I think the challenge, why the whole issue of for-profit versus not-for-profit has become an election issue, and why two parties are focusing on this and talking about phasing this out, is that prior to the pandemic, we knew that when you look at the literature, the evidence that is available out there time and time again, on balance, we find that for-profit operators of long-term care tend to have poor quality standards. Charlene helped to lay all those metrics out that we know time and time again show. We know during the pandemic that again, we saw poor performance, and especially around large chain operated homes. And the challenge was that it's not just the fact that we have a system where, again, if you're a not-for-profit operator, you're not looking at making a profit. When you're a for-profit operator, you've got to make a profit, and you've got to be in the business of delivering care. This is a challenge, because you're trying to do this in a grossly underfunded system. This is bad sad, especially in a system where we don't have very good enforcement systems. Again, this was a government that actually did away with our comprehensive inspection process right as the pandemic was running up. It's created more tougher legislation that it's actually never really used to actually take away a license or deliver a fine. It's actually rewarded a lot of operators who haven't done terribly well with more licenses, and more licenses do the same thing. And it created a liability shield saying, again, only if you have gross negligence and it can be proven by these families and these workers will you get sued. So it's a business, frankly, that you can't lose money, even if you tried, frankly, as far as I'm concerned. And that troubles me in terms of a basis for building a bigger system that incorporates those attitudes.
All right, let's just get the Green Party on the record here for what they have on offer for long-term care. They would retrofit all provincially owned buildings with priority given to community housing and long-term care homes, and they would increase access to mental health care workers in long-term care residences. I have literally a minute left just to ask. I want to ask Donna and Charlene. I mean, yours are kind of political action committees, not just organizations. Do you intend to endorse any party before Election Day? Charlene, how about it?
No, SEIU doesn't come out and endorse. We definitely endorse the platform and the work that they are committing to do. We've met with many of these politicians, and what's great about some of them, not all of them, including the one that's running for re-election as premier, have met face to face with our members. So they talk to us. We share our.
But no formal endorsement coming.
No formal endorsement. It's more on the plan that works for the frontline workers and the seniors.
Understood. Donna Duncan, how about your association?
Well, we've met with all the parties as well, Steve, and notwithstanding the focus on ownership, we've been really clear with all parties. We're going to work with whomever gets elected. We represent nonprofit, for-profit, and municipal homes across the province, and for us, the focus is on people. You'll see us focusing on our residents, on our staff, on our caregivers.
But no endorsement
that's
coming.
The focus.
Okay,
No endorsement on any one party.
Good to know. Samir Sinha, Donna Duncan, Charlene Stewart, as always, we're grateful for your time here on TVO tonight. Many thanks.
Thank you.
Thank you. Stay safe.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.